Hello, everybody. Welcome to the webinar. Welcome to Careers in Local and State Public Health, Find Your Passion. We're going to wait 30 more seconds for people to join, and then we're going to get started. All right, good evening, everybody. Thank you so much for joining us tonight for our career event, Careers in Local and State Public Health, Find Your Passion. My name is Tali Schiller, and I'm the program manager of the Academic Public Health Corps, which is one of the organizations that is sponsoring tonight's event. And I'm very happy to welcome you all, and I'm going to start up top with some housekeeping stuff to start us off. So all of the links, all of the resources and the slides, everything that we cover tonight is going to be emailed out to everybody who is attending and who registered, including a recording of tonight's event. So if you miss something, if you miss a link, that's absolutely okay. You'll get all of everything in an email. We welcome your questions. We'd love to answer your questions. So please put questions in the Q&A box at any time. We will be answering questions at the end, but feel free to put them in the Q&A box anytime and we will get back to them. And we, of course, have an evaluation for today's event. So we would love for you to fill out the evaluation. We always love getting feedback. So I will remind you about the eval again at the end of the event. So without further ado, I would love to introduce our moderator for today's event, Amy Gilbert Loynaz. Amy is currently with the University of Massachusetts Amherst School of Public Health and Health Sciences, where she has overseen internships, practicums, and employer engagement initiatives since 2018. She works with students and employers in the field to create experiential opportunities for both undergraduate and graduate students that align with their professional interests and career goals. Amy also advises students in career planning, goal setting, and professional skills building. From 2020 to 2021, she managed the COVID-19 contact tracing program for UMass, where she led over 50 undergrad contact tracers and 5 graduate team leads in school's COVID response. During the same period, she represented UMass Amherst on the leadership team of the Academic Public Health Corps. Amy received her undergraduate degree in history from Mount Holyoke College and a Master's of Education and a Master's of Public Health from Harvard Graduate School of Education and the Harvard T.H. Chan School of Public Health, respectively. She was born in South Korea and spent most of her childhood in Hawaii and New Jersey. She lives with her husband and 3 children in Amherst and looks to and learns from Gen Z about how to prioritize work-life balance. Wonderful. Thank you so much, Amy.
Thank you, Tali. It's great to be here. And I feel so fortunate to have been asked to introduce these wonderful public health professionals. I had a chance to work with all of them in different capacities through the Academic Public Health Corps, and it's really an honor. So let me begin by introducing Antonia Blinn. Antonia has been the Director of Performance Management and Quality Improvement at the Massachusetts Department of Public Health for the past 7 years. Antonia has focused on establishing and fostering a culture that supports and promotes performance goals and quality improvement. She established the department's Academic Health Department, a growing partnership with academic institutions through internships and career development, skills development, and opportunities for DPH staff. And I would be remiss if I didn't say the Academic Health Department was also the creator of the Academic Public Health Corps. Antonia is chair of the department's Performance Management and Quality Improvement Council and co-facilitator for the department's Strategic Plan and Cross-Department Racial Equity Collaborative. Antonia is also the co-facilitator of the Interagency Tribal Partner Work Group, a cross-agency group dedicated to collaborating with tribes and tribal serving organizations in Massachusetts. And that's very timely this week. And Tanya also worked with her colleague, Erica Pidad, to establish the Vaccine Equity Initiative workflow dedicated to tribes, Native Americans, Alaskan Natives, Pacific Islanders, Native Hawaiians, and Indigenous peoples. And Tanya was appointed to the Mansfield Board of Health in 2018 by the Mansfield Select Board and was elected chair in 2019, leading the board through the pandemic and the town as the town instituted a mask mandate. And Tanya holds a Bachelor of Science in Community Health Education from the University of North Carolina at Greensboro. And Tanya is also an alumnus of the Massachusetts Institute for Community Health Leadership and holds a Lean in Healthcare certificate from Massey Graduate School of Business at Belmont University in Nashville, Tennessee. And Tanya enjoys spending time with her college-age baseball playing son, very talented baseball playing son, husband, and their 3 cats. She also enjoys spending time with friends, scrapbooking, going on long walks, and many other things. She's also a skier. She's a wonderful person. So welcome in, Tanya. And I would also like to introduce next Phyllis Williams Thompson. She is the Deputy Director for Workforce Development for the Massachusetts Department of Public Health, Office of Local and Regional Health. Phyllis joined DPH nearly a year ago and comes to the department with talent acquisition experience at a startup technology nonprofit. Higher education experience as a director of career development, communications, and marketing experience with a federal contractor for the CDC, and over 16 years of experience with a national nonprofit organization focused on maternal, child, and adolescent preventative health campaigns. Phyllis holds a master's degree in communication and information management from Bay Path University and a bachelor's in communications from Augsburg University. She is the proud mother of 3 children, a son serving in the military, a daughter attending her 2nd year of college, and her youngest daughter, a high school senior who is also college bound. She is also married to her partner of nearly 30 years and enjoys traveling the world with her family. Phyllis says her largest achievement of her career was actually a volunteer experience for education equity. She wrote and secured a multi-million-dollar grant to improve her children's underperforming urban school to become one of the #1 schools in Massachusetts, and received commendations at the time from Governor Deval Patrick. Phyllis also led the faculty and parent-led committee to work on the school improvements, which include state curriculum design implementation, a state-of-the-art library, laptops for over 450 students in the school, and additional funding for instructional design and teacher salary increases, and wraparound support services for underrepresented students and their families. Welcome, Phyllis. I will turn it over to both of you in your very capable hands. Please go forward. Thank you.
Thank you so much, Amy. It's such a pleasure to be back in such great space with you. So thank you for your kind introductions of both Phyllis and I. We're really excited to share with you some of the tips and tricks that we're hoping that you will take on and find an interest in working at the State Department of Public Health. I'm going to put this in hopefully full mode here. There we go. Awesome. So in the course of this first part of the webinar, we're going to share with you where the Massachusetts Department of Public Health resides within the Commonwealth, within our state government. We'll talk about how DPH is organized, so you can think about some of the topic areas, bureaus, or offices that you might be interested in. We'll talk a little bit about some of the career pathways or job classifications or job descriptions as they are listed in our Mass Careers system, which is the Commonwealth system for finding jobs in most of state government. And then show you how to find jobs within DPH, talk about the benefits, as well as many other resources and tips that can support you in your public health journey. So to begin with, the department resides within the Executive Office of Health and Human Services. It is the largest secretariat in state government and is comprised of 12 agencies, as well as 2 soldier homes and the Mass Health Program, which is the state's Medicaid program. The agencies that you see listed here also use Mass Careers, but as you can see, the Mass Department of Public Health reports up to the Executive Office of Health and Human Services. And so when you hear people talking about the Secretary of Health and Human Services, that's who the Department of Public Health is reporting directly to. So how are we organized at the department? We're organized in a series of bureaus and offices. Starting on the left side of this slide is the list of all of the bureaus. So if you're interested in family health and nutrition, WIC services, early intervention, being able to be in programs that support families of children with special health needs, that would be the bureau that you'd want to be interested in looking more about. If you are interested in community health and prevention, like asthma, comprehensive cancer control, oral health, community health workers, those are the things that you would find in community health and prevention, to name a few. And I will say that BCHAP, the Bureau of Community Health and Prevention, is our largest bureau in the department. It has the most number of programming, different topical areas as well, so certainly worth checking out. The Bureau of Environmental Health deals with exactly that. So environmental meaning housing, lead, climate area, climate change, heat indexes, really tracking how our climate, beaches, how those are being opened or closed due to whatever contaminants may be making its way into our waterways. Then there's the Bureau of Health Professions licensure. This includes over 20 different kinds of licensures. So everything from community health workers, genetic counselors, doctors, nurses, perfusionists, which I didn't even know what a perfusionist was before I worked at the Department of Public Health, has something to do with monitoring cardiac information. So all kinds of things that are licensed, including now coming into the department, some other additional beyond the 23 that they currently oversee. Then there's the Bureau of Substance Addiction Services, and this is the bureau that licenses prevention, treatment, and recovery programs around addiction services. So you can think about all different kinds of addictions, and I have a sense that our BSAFs, our Bureau of Substance Addiction Services, has a program around that. We also have a bureau, which I'm sure everyone can relate to right now, given the fact that we're hopefully coming out of a pandemic and moving into an endemic, our Bureau of Infectious Disease and Laboratory Sciences. This is where the state lab is, our Office of HIV Services and other testing and prevention and treatment services. And then the last bureau is the Bureau of Healthcare Safety and Quality. We've all experienced and benefited from the work of this bureau because I'm sure we've all accessed healthcare in the state of Massachusetts. So every ambulatory care facility, hospital, long-term care facility is licensed through an agreement with CMS through the Massachusetts Department of Public Health. So we have nurses, we have other staff who do monitoring to make sure that each of these healthcare facilities is living up to the standards that are expected across the country. So in the middle, we begin talking about the offices. So there's the Office of Local and Regional Health. This is the bureau that Phyllis is in and has really grown the most in the last just 12 months. And so there's a lot of opportunity to support local public health, because there are 351 municipalities in Massachusetts that they are supporting. And it's everything from helping individual towns or municipalities to work together on public health excellence grants, ensuring and understanding if the standards that Massachusetts sets through its regulations are being carried out at the local level, and providing that technical assistance and support around health and racial equity. We really are focused on supporting local municipalities like the one that I live in, which I am personally very grateful for. The Office of Preparedness and Emergency Management, I think that name speaks for itself as far as really trying to support every area, continuity of operations, things like that, regionalization of health and hospitals when it comes to responding to emergencies. If we had a flood in an area and Healthcare facilities need to be evacuated. They quickly alert a system, and everyone who's part of a healthcare system will get notified. They'll be asked to report, for example, the number of available beds so that they could accept transfers from an unsafe environment to a very safe environment elsewhere. The Office of Population Health, this is one of our newer offices. It encompasses the Office of Health Equity, Special Analytics, the Office of Data Management and Outcomes Assessment, Policy Planning, and Data Integration. And if you've seen any of our reporting on opioids or on some maternal child health metrics, you can believe that data from all across the department comes into the Office of Population Health, and through the Special Analytics Unit or Policy Planning and Data Integration, the data is released and provided to the public, which has been incredibly helpful as we seek to pull more and more data sets together to have a better understanding of where we might be able to prevent death or injury and create programming to better support the health of everyone in the Commonwealth. And then on the far right in this last column, I'll just very quickly say that we have an Office of General Counsel. So if you have any lawyer friends, we always need great lawyers. There are over 35 that work within the Office of the General Counsel. They're paired with many of our programs in the other bureaus and offices. And then specifically, there is an Office of Privacy and Data Compliance. As you can imagine, with having lots of surveillance systems, lots of individual health information, it is absolutely imperative that we do everything possible to protect the privacy, confidentiality, and integrity of all of our data sets, systems, and structures. The Office of the Chief Financial Officer, I always feel like people don't think about public health in the finance world, but we still need good accountants, management analysts, and of course, as a state entity, being able to purchase services. We can't just go out and buy a pen and be reimbursed. We do have procurement processes. And so there are folks on staff, and we actually have an opportunity that's listed in Mass Careers around that as well. And then I bet you didn't even know that we have 4 public health hospitals as well. So these are located in Tewksbury. Pappas Rehabilitation Center for Children is located in Canton. Lemuel Shattuck Hospital is located in Jamaica Plain, moving over into downtown, excuse me, not downtown, but Boston, within Boston Medical Center. And then Western Massachusetts Hospital, which is located in Westfield. So as you are thinking about what you like about public health, you may find that it is within one of these bureaus or offices. So think about how you might want to do a job search with that. So we've done a really great job of spotlighting a few of our positions within the Department of Public Health on our Careers at DPH webpage. So you can connect to the link here to click specifically on the one for social workers. I wanted to highlight this gentleman. His name is Samuel Valentin, and he is a lab tech at our Tewksbury Hospital. So you can read about his experience at the department as well as social workers, because you probably weren't thinking that we have all kinds of staff, including lab techs and social workers within the department. So you may be asking, well, what are these public health related positions and how might I look for them? As you begin your search in Mass Careers, which is the website to begin looking for jobs at the Department of Public Health, as well as many of the other agencies I listed within the Secretariat or across the department and the state, you may find that you are interested in doing data analysis. And so you've got a background in epidemiology. So you might look for an epidemiologist position, and you might notice that positions have a 1 or a 2 or a 3 or some other number associated with it. As a person who has recently graduated from an undergraduate program, if you have at least a year or 2 of experience, it depends on the position, you would most likely be looking for in the Roman numeral 1. So whether it's as a research analyst or a program coordinator, basically you start out at 1 based on your level of experience. And The more experience you have, the higher Roman numeral of that classification or job position that you would be eligible to apply for. There's also really specific information about that, and I'll show you where to find it. So we've got a great landing page, mass.gov working at DPH, where you can check out some of the great opportunities that are highlighted on that webpage. And when you go to the Mass Careers webpage, it says find your future Commonwealth job. And they say that because it's not just DPH, it's all of the Commonwealth. And there's a really, really great tool that's also on this page to link to that has frequently asked questions. So when you go into Mass Careers, there's two avenues. One is you go in through an external person looking for a position, and you can search any of them. The other is to create a profile. And this is where you put in your personal information, your name, your address, you upload a resume, and then you can put in common terms that the system will then inform you when a position is posted with that information in it. So it's almost like having a job finder work for you. I'm sure you've all experienced registering with like Indeed or something like that. And sometimes our positions are also listed on Indeed as well. So with Mass Careers, when you go in, you will see it say job opportunities. There is information if there's a specific job title that you're trying to find, you can find that, you can type it in here or just type in a keyword. What I did for our search to get it started is I actually clicked on, there's boxes, like a little panel on this left-hand side. I clicked on it and pops up organization. So I said, I only want to see Department of Public Health positions. And the day in which Phyllis and I did these screenshots, I believe it was September the 21st, if I can see that correctly on the listing of jobs, there were 86 positions. So yes, to say that there are a few jobs is an understatement. So please take a moment if you want to see what's at the department to organize and look at it that way. Then what you're able to do is on the right-hand side of this screen, you'll see in blue titles: Licensed Evaluation Coordinator, Senior Manager of Compliance, Clinical Microbiologist. So these are the job positions that are posted. You can also see in between each one, there's a line, and at the bottom, it has a posting date. So this one says September 21st, because that's when we did the screenshot for this particular slide. But what you want to make sure you do is you check that posting date. If it is within 14 days of the date of posting, that's when you want to make sure you get your resume and your application in order to be considered. If you end up applying outside of that 14-day window, it's possible that we might not actually see your resume or know that you applied. So if you have any hesitation, you're like, well, maybe I might just do it, just apply, make sure you get in before that 14-day window expires. So when you open up a job description, this is the list of information that will be in every single description. So the first will be the actual description. You know, what is the person in this role going to be doing? It's a very brief description, usually about a paragraph. Then you'll see duties and responsibilities. And then you will see required qualifications. You definitely want to check this part out to make sure that you meet these qualifications. There's often some skills, some years of experience that may be listed in this. After that, you will find a list of preferred qualifications. And it's really helpful as you look at these to make sure if you have some of these preferred qualifications that you are putting these in your cover letter, putting them in your resume, making sure that the connection can be made about why you are qualified for this position. The next information in the job description will be the information about the bureau or office where the position is located, which is then followed by the department's information or whatever agency the position you're looking at. Then it lists what the pre-hire process is, and I can tell you every single pre-hire process is very similar. So there are interviews, sometimes 2 or 3. There could be another conversation about salary. There could also be a the request to provide information to check references when folks are getting it down to the final couple of candidates. And then once any approvals that are needed, if they need to go up higher than the hiring manager, which some of them do, there's a little bit of a process for that too. So those pre-hire processes are explained very briefly, but they are there. And then, not to make light of this, but then there's the qualifications section. This is where you want to look as well, because if you have a bachelor's degree or if you have a master's degree, your educational attainment can count as actual years of experience. So look in that qualification section and see what it says. It likely will have an A, a B, or an A, B, and a C. And so look at your highest level of educational attainment, or that which you're just about to seek, whether you're about to graduate from a program. Then you can determine if you will be really eligible for this position as well. So the last section is the minimum entrance requirements. Our colleagues, I believe they affectionately call these MERS, but these are really what you are required to answer as you are applying for a particular position. And so if you are answering any of these questions and they are no, they could be automatic disqualifiers for you. And our HR team does double check. So please be honest with us when you're applying, because we don't want to waste your time and you don't want to waste our time, because our time is so, so precious. So I'm passing this over to Phyllis now, who will walk you through a job description and provide some tips on applying for these really awesome positions. Phyllis, take it away.
All right, thank you, Antanya. Next slide, please. So I'm going to give you just an overview of a job description, what it looks like, so you can get familiar. So Antanya already gave you the sections in the job description. But what I want to point out here is those required qualifications, making sure that you're reading that closely. And then preferred qualifications, what I want to say about that is don't let that make you just kind of put the job away and not go for it. If it says preferred and you don't have those qualifications, still see if you have all the required qualifications and apply. Next slide. This gets deeper into the job description. Basically more about the individual bureau or office, and then the department in the pre-hire process, the qualifications, and then a little bit on our benefits. So you can also go onto our website and check that as well. And what's nice about the Commonwealth positions is they do give you a salary range. So take a look at that. It doesn't mean that you're going to end up with the highest salary range. You know, of course, people get big eyes and they look at those numbers and they say, yay, I'm going to be at the top range. So it just kind of gives you an idea. And as Antanya was talking about earlier, if you fall into a 1 or a 2 or a 3, that'll kind of give you an idea of the salary range might be more at the starting range to mid-range. Next slide. So I'm not going to go through these in detail because of interest of time, but these are the steps. So you're going to get these slides, and if you follow the step-by-step process, you will be able to create your MassCareers profile. I'm going to go to the next slide on step 9. So what I want to make sure that you do is that when you create, use an email address, that you're using your professional personal email. So what I mean by that, it's something that contains your full name, and it's not good to use your work or your academic institution. And the reason for that is at any given moment, you don't know if you can get into your work one or your academic institution. And it's just more professional to use a personal email that contains your full name. The Commonwealth will be using this information to communicate with you throughout your entire process. So that's why it's really important, so you could access that email and get into it regularly. So I would recommend that you follow those steps. Now I'm going to give you a couple of points about developing a powerful resume for DPH. So you want to make sure that you read through that job description very carefully. When you're writing your resume points and phrases, you want to reflect what is required from the DPH job description. description. So you want to use some of those starting points of the bullets within the DPH job description. You're not copying word for word, but what you're going to do is use some of those action verbs. And then erase from your mind the one-page resume rule from your brain. I know a lot of career directors probably tell you that at the start of your undergraduate for sure, but there's no rule here. If you have that quantifiable experience, you want to make sure that that's in your resume because that will add up for you for DPH. Next slide. Then I have some examples of writing a quantifiable resume, points and phrases. So I give you an example here that's from the direct job description that we showed you. And then an example of a quantified resume phrase is basically saying approximately how many assessment interviews did you do with patients, for example. This gives basically the interview team and the HR folks an idea that you're really familiar with this type of work and that you would be a great subject matter expert on this. Next slide. And then everybody knows about the power action verbs. So just make sure that you're taking a look at those job descriptions, comparing, looking at different action verbs that you'd like to use and make sure that you vary them. Don't use facilitated, for example, 3 times in a row on your resume points. And then you want to focus on the power action verbs that you'll be using if you landed the job. So if you landed the job, if you're going to be doing things that involve cultivating or overseeing, directing, and coordinating, you want to actually use those verbs. Next slide. And then your academic experiences in the field really create high impact. So your professional work experience create a very high impact and count towards years of experience, even outside the field of public health. So I'm going to say that again, even outside the field of public health. So don't think that you just have to have experience in public health. You can definitely have other experiences. And then your academic experiences, the academia folks will love me for this. They create high impact results in terms of your interview process with hiring managers, and it helps showcase your reputation and your familiarity and knowledge of a chosen field. And the academic experiences also help showcase transferable skills into a new field where you have less work experience. And then the next slide. So editing your resume is really important. Just make sure that you get that out to your family, your friends, your career centers, your advisors, so they can review your resume and give you some tips. A fresh set of eyes on the resume always finds mistakes and errors. We all make them, especially when we're doing a lot of things on the screen. So you want to make sure if you develop it on the screen that you take it off screen and print it out and actually use hard copy paper and review that resume because your eyes will pick up the errors. And then the next one I want to cover really quickly are just protocols for your email, your voicemail, and your phone. These are the things that we don't really think about. It seems really kind of basic common sense, but you want to have a professional voicemail message on the phone number that you place on the resume, including your full name. I've heard a lot of interesting voicemail messages being a career director. So you can imagine, you want to set that professional tone right away and then have a professional personal email. So you don't want something like I love chocolate 123 at whatever internet provider. You want something that contains your first name and your last name is the best. Making sure that your email and phone is accurate. I've even gone as far as sending an email to myself to make sure, because we often might forget a letter in our name, when we're typing and looking on screen and we're tired or we're doing it late at night. So it's really important to check these things. Clear out old voicemail to make space for DPH to leave a voicemail. You wouldn't want DPH calling and your voicemail is full and they can't leave the message that they need to leave. And then checking your email regularly, your inbox and spam for Mass Careers email communications, and then becoming aware of what that Mass Careers email looks like. And then getting back to your HR and hiring committee member or manager quickly within 24 hours. This is really important because searches, they're dealing with lots of different people. And so if you get a call, you want to definitely a call or an email, get back to them right away. And that's all I have. Thank you.
Thank you so much, Phyllis and Tanya. That was wonderful. Now it's my great honor to introduce Dawn Carmen Sieber. And I also worked with Dawn on the leadership team at the beginning of the APHC, so I'm really happy to see her again. Dawn received her BA in elementary education from the University of Massachusetts Amherst, yay, go Minutemen, and master's degree in counseling from Northeastern University in Boston. Dawn is currently the executive director of the Massachusetts Health Officers Association, whose 600 plus members are local public health professionals. Dawn has worked in the field of local public health for more than 25 years. And I'd also like to say that the Mass Health Officers Association administers the Academic Public Health Corps. So they're doing an amazing service for the state of Massachusetts. Before joining MHOA, Dawn served for 12 years as the Director of Emergency Preparedness for the Brookline, Massachusetts Public Health Department and coordinated the Brookline Medical Reserve Corps. Dawn also led a 5 community tobacco control collaborative. And so Dawn, it's really wonderful to see you. And she's a great role model for everyone thinking about being a working professional and spending a lot of time with your family as well. Take it away, Dawn.
Thank you very much, Amy. And thanks to Antonia and to Phyllis for their great presentation about the Department of Public Health. So I'm going to talk to you a little bit about local public health. And I'm going to be quick, but it's very different than the state public health department, because as Antonia said at the beginning, we have 351 health departments in Massachusetts. And depending upon where you're from, you may come from a state with 6. So we have 351. So we have the city of Boston or Cambridge or Springfield, and then we have little towns. So public health in Massachusetts looks different all across the Commonwealth. The regulatory work is the same, but it looks very different depending upon where you are. So when I talk about looking for jobs, it will vary widely. Because no 2 health departments are the same. Massachusetts is working to change that a little bit, and I'll tell you a little bit about that in a minute. I'm assuming you can see my screen because I can see it, but I'm going to tell you a little bit about Massachusetts public health. So in Massachusetts, and this is just a little bit, most money comes from local health departments. So it's not an equitable system. So some communities fund their health departments well, and others do not. So there's some money now, much more from the Department of Public Health, and we are working MHOA along with our DPH, Department of Public Health partners, and a strategy firm on a capacity assessment. And we are knee deep in it, assessing the capacity of health departments in Massachusetts so that we can fill the gaps, and we, being DPH, can fill the gaps and help local health become more equitable in the Commonwealth. So Antonia is the chair of her Board of Health, and the boards of health oversee the staff. It's different in communities, not all, when I talk, no 2 community, well, I shouldn't say that. Communities are very different and very varied. But Antonia would be the authority, she and her board, and our health department staff would work for her and with her. So what does local public health do? So what I want you to think of is local public health is the boots on the ground. They are the ones that are inspecting the restaurants. They are the one that had the boots on the ground during COVID. Plus they do many, many other things. And you see this list here, and this is a list of some of the things that local public health is involved in. And here is more. And certainly with COVID, you saw a lot more of disease surveillance, I can't say it, disease case management, health promotion, immunizations. So it's a wide range. You could be inspecting a pool or a camp one day or a few minutes. Later in the day, there could be a rat complaint. And later in the day, you could be looking at housing. And then you could be having a flu or COVID clinic that night. So it is a very, very varied job. And again, it depends upon where you are, what you do. So we have in Massachusetts the Coalition for Local Public Health, and the 6 statewide public health organizations work together to advocate and support public health across the Commonwealth. And we have worked on bills and all kinds of different things and promoting healthy communities across Massachusetts. I would urge you to check out some of these sites. They are all sites, I'll tell you in a moment, that have jobs offering, but and some more than others, but they're all interesting. And if you want to learn about local public health and what happens in Massachusetts, these would be the organizations you want to look at. Additionally, in terms of looking at careers, the Local Public Health Institute at BU, where some of you may be students, has a lot of terrific courses that will help you learn about local public health. And when you go to apply for a job, if you can say that you have taken these certificate courses about housing, about emergency preparedness, about septic systems, about food, it would be really helpful to you for local public health to see. In addition, the New England Interstate Water Pollution Control, NUIPIC as we call it, has some really great courses that relate to water and to waste management and other kinds of things like that. Again, this is the Coalition for Local Public Health website, so you can look there. NACCHO is the National Association of County and City Health Officials. So if you're looking for a job in public health in another part of the country, or with a national organization, NACCHO is a fabulous organization. They are an incredible resource, and they have a career page as well. They offer courses, they have toolkits, they have all kinds of really, really great information to help you learn about what local public health looks like across the country. And MHOA, the organization for whom I work, we are an affiliate. We are called ASACHO, a State Association of County and City Health Officials. And I work with my colleagues across the country. NACCHO is a terrific resource. And as I said, they too have a career site for all different kinds of jobs, and they are always hiring. Additionally, sorry, something is, my slides do not want to advance. I'm not sure why, but let me just, oh, my computer is frozen. Of course, let me just see what I can do here. Sorry, 1 second, a little technical.
Yeah, sometimes if you stop sharing and reshare, it'll
Yeah,
behave
I might
again.
have to do that. Sorry.
No worries.
Thank you.
This is a part of our daily life now, technology, right?
Yeah, I'll actually share this with you just as, and I'll go back to my slides. But this is a screen share from our MHOA site, which lists jobs. And it's, you'll see some are a little bit older. I don't know if you can see me scroll down on this, but and we have Department of Public Health jobs, and we have jobs all across the Commonwealth. And there are about 25 or 26 jobs currently advertised. Even though some of them are old, they have not yet been filled. So, but some of them, you know, depending if you happen to be a nursing student or someone you know who is a nursing student, you might be able to connect them with a job. But you can see some of the different types of jobs, from environmental health inspector to regional health inspector to a mental health liaison, lots of and different jobs and different job descriptions for each. So let me try to share this, and I only have a few more slides, and I'm sorry for the technical. Yeah, I'm back stuck. Okay. So another way, if you are not an academic public health corps intern currently, interns do get paid. Look at joining us for the summer of 2023. It's a fabulous opportunity to learn about local public health. You'll get the slide, so you'll get more information, but it really is a terrific opportunity. We currently have, I think Tali can let us know, but around 30 interns working for and with local public health and supporting what we do. So again, more job sites. I just showed you MHOAs, the Massachusetts Environmental Health Association, the Massachusetts Municipal Association, which has more wide-ranging local public health jobs, and NACCHO also, as I said, have a lot of jobs advertised. So a couple of things to know. If you think you're interested in local public health, I would check out on the MHOA site. I would definitely spend some time on our site. I would check out the orientation and resource guide, because that really covers, you don't have to go to all the links that are there, but there are little introductions in each section which talk about all of the varied jobs that local public health do. Local public health does. These are some of the credentials and certifications that you could easily get online from FEMA. They're really important to have, and local health would look, if you had some of those, they would be interested to see that, because it shows you're interested. And these are some of the certifications that local public health officials have. I won't go through all of them, but you can read about them. Some of them take the RS, for instance, takes a lot of studying and a pretty extensive exam, but you can look at those and find out what they are and read some about them. If you're interested, if you go to the MHOA website, we have a lending library and we have books that have some of the topic areas related to these certifications, and you could absolutely borrow some of them. So that is pretty much it for me. If you're interested in learning more about local public health, I'm happy to talk with you directly and tell you about what a wonderful field it is. I've worked in local public health for many years, and there are lots of opportunities and many varied jobs. And as I said, it's the boots on the ground. It's really the day-to-day work with the constituents in Massachusetts, and with some really interesting public health issues, depending, and as I said, it varies depending upon where you are. So thank you, and I will turn it back to Amy.
Thank you so much, Dawn. That was wonderful. Now I'd just like to ask the panelists, any of you can take this question. What skill set do you think is the most important for jobs in state and local health? And what advice would you give students or recent graduates who are just starting out in their career to get them prepared for such a job?
I can take part of that question. So I think as a person who is just starting out in a career, get any experience that you can. And there are so many opportunities to do that, especially right now, either through the APHC, if you're interested in local public health. Also, someone asked a question about internships at DPH, and in that response, I included the link to the internship page at DPH. Unpaid opportunities are listed there. The link to the Mass Careers page is where you want to go for some paid internship opportunities as well. So whatever experience you can get that can potentially be applicable. So you can understand how a system works, how an organization or a state, whatever it is, getting that even little bit of experience will go a long way, because then you'll know more about what might be expected in a role, in either local or state public health.
I can add to that too. Definitely utilizing your career centers. If you're at community college or undergraduate institution graduate, for example, making sure that you're talking with them. They have many resources for exploring different fields and titles of positions, and they can give you really a great basis. They actually have some really great assessment tools too, to see how your personality and your learning style and your work ethic would fit into a particular field. And then I would highly recommend networking. I kind of call it my 5-friend network. So if you kind of look around and see in your network of folks that you communicate with and talk with, and to have 5 people that you talk with about your goals and your aspirations, and they will definitely give you some great ideas. And then doing some informational interviews with some of the places that you're thinking of working in. You can do that with local public health, for example. Also, Dawn pointed out some training resources. If you're interested in developing a career in public health, definitely you can use the links that she provided in her presentation with the local Public Health Institute. And we work with them as partners as well. So, yeah.
I don't have any more to add to that. I just wanted to answer one question, which was about public health nurses and what a public health nurse is. And I think the best way is to look at some of the job descriptions on the MHOA website. They're different in each community. Probably, I think Antonia's community doesn't, I don't know if you even have a public health nurse. No, she doesn't. And some communities have 2 or 3. So again, it's very different. Most of the public health or all the public health nurses I know are RNs. Some of them did not start in public health, but learned public health. Some of them do more of an epidemiologist role. Very, very varied. There is an organization, maphn.org, I think is their website. Yes, I pulled it up. And they are the Association for Public Health Nurses, and they would be a great resource to look at and find out more information about public health nursing if you're interested in that. And I can connect you with people if anybody is interested. Just one little thing, sorry, to add to the other comments is if you can find a mentor, somebody that you know and trust and work with them, I think that's always really, really helpful. And they can help you in your search in local public health or in public health and state public health or whatever you choose. And I think that's really an important thing to do if you possibly can, whether it's somebody at your school or somebody you work with currently outside of your school.
Thank you so much, Dawn. Antonia, could you briefly tell us about the support that's available to applicants and employees with disabilities?
Yes, I would really like to, because this is actually National Disabilities Awareness Month. And so we thought it would be a great opportunity to mention that in addition to having mass higher career centers, which are located across the state, you can also reach out if you are a person who has a disability and needs an accommodation. So if for some reason you cannot access a job description, or if you are in need of having an interpreter, a sign language, for example, to do an interview, our colleagues in our disabilities office, also known as our ADA coordinator, has made herself available to folks when they find that something that they need through the interview or hiring process from an access standpoint. So her name is Erin Bartlett, and she has provided an email address, which I'm going to share with Tali, because for some reason I'm not able to share it with everybody. So I'm putting it in the chat box for her, but so that'll be coming very shortly. And there is a formal way to request information, but you can start by reaching out to the ADA request email address. So we want everyone from all different perspectives and experiences, because it really makes our workplace a much better place.
Great. Thank you, Antonia. There are a couple of questions about the timeline for applications. If someone is graduating either undergrad or a graduate degree in May of 2023, when would they start doing their job search and putting in their applications and such?
I think just in terms of local public health, I think that I wouldn't say it's early. I would say it's a good time to start researching and looking at what's out there and talking to people. And I think Phyllis had said, just maybe doing some interviews with people and talking about what they might be interested in. Maybe somebody would be willing to wait until May or June. Maybe if you're graduating in May, but you're got some time, maybe you could start part-time in something. It could be, depending upon the job. Cities and towns sometimes take a while to hire somebody. There's a process. So it could take a few months anyway. So I think that there's no harm with starting early and doing research and finding out if it would be something that could work. And again, everybody's in different positions. So you might be able to start something in January 8 hours a week or something. So I think I would always look into, if you find something interesting, I would absolutely pursue it and see how it, and let the employer know where you're at and what you would like to do, and see how you could work it out.
Don, those are excellent tips. And I just want to add as well, being a former career director at a college, if you're looking at May 2023 for graduating, you want to plan for about 3 to 6 months out from that. And during the holiday break between mid-December and then the time you would have off in January, if that applies to you, that's a great time to be researching and doing your applications, and then getting the attention of your family to review cover letters and resumes for editing. And so definitely I would do a planning timeline of 3 to 6 months out.
Great, thank you so much. So we have about a minute left to answer questions before I turn it back over to Tali. But I quickly want to ask, Phyllis, maybe you can take this, since you did have an evolution in your career, and Dawn, you as well. What advice do you have for someone who's looking to re-career? Do local and state public health organizations, do they give weight to different experiences outside of public health in terms of, the value of the applicant in the pool?
Absolutely, I can speak to this. So for me, I'm working in public health. I do not have a master's in public health or an undergraduate degree in public health. I have some other degrees. I have a bachelor's of arts in communications and a master's in communications and information management. But I think it's the way that you present your information on the resume as you're telling a story, and how you relate to those job phrases and points in the job description. That's really critical. And then how you work in an interview, you want to practice your interviewing skills. So you may come in there and you're competing with others that have the Masters of Public Health, for example, and you may not have that. And you've been working, in a completely different field. And the way that you're able to maybe utilize a volunteer experience, an internship, where you got to know what public health is about, and telling that story, and also showing if you created a solution. That's something that really would be impactful, as opposed to just looking at someone with just the degree. If you're able to utilize those other experiences and make them into storytelling solution events, and also highlighting your transferable skills, you definitely will be able to do it. And I would say, don't be afraid of applying for other types of jobs in other fields. Get yourself out there. And once you do it and have the practice of getting that, landing that interview, that's going to really help a lot.
Great, wonderful. So I will turn it back over to Tali. And thank you so much to all our panelists.
Thank you, Amy, and thank you again so much to our panelists today for sharing your wisdom and your experience and your expertise. And thank you to everybody who attended today. I'm so glad that you were able to be here, and I hope that this information was useful to you and that you can use it on your own career journey. So my final words are, please fill out our evaluation. It will pop up in your browser once you exit out of the Zoom. And everybody knows that if you fill out other people's good evaluations, you will get good evaluation karma, and then people will fill out your evaluations later down the line. Yeah, everybody's nodding their heads. That's definitely how it works. So please fill out our evaluation. It's very short and we really appreciate it. And thank you all so much for being here today. Have a great rest of your night.